Welcome back to Champions of Care. Did you know that Americans can prevent 45% of colon cancer cases simply by staying lean, eating smart, and moving more? Now, to hear more about this, I want to introduce you to Sharlene Bidini. Sharlene, welcome to Champions of Care.
Thank you.
You are a board-certified oncology nutrition expert. Is that correct?
That's right.
Now, is this fact true? 45% of colon cancer cases can be eradicated by doing some things differently? Tell us more about that.
Well, the American Institute for Cancer Research says that 66,000 fewer people would be diagnosed with colorectal cancer every year if Americans would just do those three things: maintain a healthy body weight, exercise more, and then eat a plant-based diet.
That is amazing. Now, to have a healthy colon and to get the benefit of reducing cancer by as much as 45%, what are those healthy foods we should eat?
Well, there's convincing evidence that a high-fiber diet reduces colorectal cancer risk. So a high-fiber diet would be rich in fruits, vegetables, whole grains, beans, nuts, and then high-fiber cereals are also a good choice, like Raisin Bran or Fiber One.
And what are the foods that we should avoid?
The biggest piece of evidence would be suggesting to stay away from processed meats like salami, bacon, pepperoni, those things that are preserved by salting, curing, smoking, or chemical preservatives, so even deli meat. So processed meat is something that you should definitely avoid if you're trying to minimize your risk for colorectal cancer. And also red meat should be limited. So 18 ounces in a week is the marker that we would recommend not going above. And red meat would also include beef, pork, and lamb.
18 ounces seems pretty manageable. Now, you have talked about the connection between maintaining a healthy weight and a healthy life. And can you talk a little bit about the connection between moving more and preventative measures for colorectal cancer?
Again, the studies suggest that exercising reduces colorectal cancer risk. The American Cancer Society suggests 150 minutes of moderate exercise per week. So if you broke that down into 5 days a week, it's just a half an hour of moderate exercise. And if you're physically capable, vigorous exercise produces additional benefit.
And can you do that vigorous exercise in little pieces, or does it have to be done in extended periods of time?
No, it doesn't have to be done in extended periods of time. And of course, you would want to ask your physician for personalized recommendations given your other comorbidities.
Now, what about supplements? And I'm especially curious to understand better the role of vitamin D.
Well, the research suggests that people that are deficient in vitamin D are at greater risk for colorectal cancer. And it is really quite complicated sometimes to get adequate vitamin D. Those that are at greatest risk for vitamin D deficiency would include the elderly, people that don't go outdoors very much to produce their own vitamin D, or those that do go outdoors but have all of their skin covered. So if you are suspicious that you may be deficient, when you go have your physical exam, you could ask your physician if he could check your vitamin D level. The same way your physician's able to check your B12, your iron, your folate, your vitamin D could also be checked for deficiency. And your physician would prescribe vitamin D, or another way is to purchase it over the counter. Now, I do want to mention that the Institute of Medicine came out with new guidelines for vitamin D, but they specifically said this is the amount that Americans need for bone health. And that's because we're still doing studies on the effect on cancer risk and cancer outcomes. So right now we know vitamin D deficiency leads to higher colorectal risk, but we're not exactly sure if it makes a difference on the outcome once you're diagnosed with colorectal cancer. So for now, 600 international units per day is what's needed for most Americans. And if you're over 70, you need at least 800 international units. And I want to demonstrate how that might be complicated to achieve through diet alone. If you were to drink 8 ounces of milk, that would provide 100 international units of vitamin D. So if you're trying to reach 600, as an example, you'd have to drink 6 glasses of milk.
That's a lot of milk.
Or the other things that are rich would be salmon, tuna, mackerel. Those might have as much as 300 international units, but it is difficult to get through diet alone. So I just brought with me a couple of different over-the-counter supplements to show as an example. This is an example of the Citracal, and you would have to take 2 of these to equal 500 international units.
And a glass of milk and you're set for the day.
Exactly, that's exactly my point. But as you can see, they are a little bit big. They're a little big, I should say. So one chewable Viactive provides 500 international units, and it's about the size of a Tootsie Roll.
And it's chocolate.
And it's chocolate, and it tastes good. But one reason that you do want to always get your physician's approval when you're taking over-the-counter pills and supplements, I just wanted to show, like this one also has vitamin K in it, and that may be contraindicated for those people that are on blood thinners. So anytime you do take something over-the-counter, you just want to make sure that your physician is aware.
Well, I want to thank you for making us aware about nutritional aspects of colon health and for being with us today on Champions of Care. Thank you, Sharlene.
Thank you. It was my pleasure.
I also want to thank Dr. Fouad Azrak, Dr. Malcolm Hennock, Dr. Ricardo Borrego, and Dr. Charles Sloan, and all of the staff and crew of the Champions of Care team. For more information on colon health and colonoscopies, go to oakwood.org or give us a call at 1-800-543-WELL. Thanks for joining us on Champions of Care.